Tēnei te ara ki a ranginui, tēnei te ara ki a papatuanaku. Tēnei te ara ki a ranginui rāo ko papatuanaku. No rāo ngā tapawai o tāne māhuti ki raro. Hare atu te awa tia kahuri ki te pō, uhi, oero, tau mai te Māori, haumie, hui e, tai ki e.
One in 10 patients will experience harm during the course of their healthcare treatment. This statistic remains unchanged despite 2 decades of healthcare improvement. In the aftermath of harm and the processes that follow, disclosure, investigation, resolution and change, the experience of harm can be compounded and result in significant human impacts. Restorative practice and hoho tolongopai offer a way forward. Both provide a relational framework and together have the potential to radically shift the process, conduct and outcomes of how we respond to healthcare harm.
A restorative approach is a voluntary relational process where those affected by a harmful event come together in a safe and supportive environment to talk truthfully and openly about what happened, the impact it's had on their lives, and to clarify the responsibility for the actions for healing and learning.
Hohoi to me means the restoration of mana, of well-being. It's done through whanaungatanga. Hohoi connects as an option, a pathway of resolving complaints and adverse events that is consistent with a Māori understanding of well-being.
I've witnessed harm occur to patients, to families and to health professionals from multiple causative agents. You can have harm from adverse events, side effects, bullying, conflict, toxic work environments, and you can also experience harm from the emotional toil of healthcare work itself.
What I think we need to understand is our system's perceived as a threat to whānau Māori. So when they're coming into our system, then they're not starting in a place of trust. The system works when people believe it's going to work for them. And if you have a whole group of the population who fundamentally don't believe the system is going to work for them, then they're starting from less than zero.
So current investigative approaches to harm are really well intentioned, but what the current approach is characterised by is letter writing, written documents, and generally there's somebody that decides whether or not a harmful event has or has not occurred.
They are a risk approach to managing adverse events, complaints and feedback, rather than a relational approach for managing those things. And so what that does is it actually ends up separating people.
There's an awful statistic around doctors that actually when we're talking to a patient, we usually interrupt within the first 30 seconds.
And if you look at the health and disability process, if you get to the investigation stage, the patient actually doesn't have a voice, you know, and I think that's wrong.
We can inadvertently amplify the harms by following a process that doesn't address people's needs.
With the restorative justice process, you know, everybody gets to tell their views. The difference between reading a report and sitting down with a patient and hearing their story is huge.
So for me, there's lots of synergies between clinical work and what is provided by restorative practice because it's fundamentally predicated on healing.
What restorative practice does, you have a format where you actually truly just sit back and you let the story go. You cannot put your own take on it until you've heard the whole lot. And that actually takes you in a different direction than where you would have gone if you'd only reacted to part of the question.
It's actually about really seeing and understanding the impacts on each other in order to be able to heal within ourselves and heal our relationships. And we can do that in restorative conversations, we can do it in facilitated meetings between two parties, or we can do it in restorative circles. Restorative circles are a structured dialogue in which we sit in a circle, which equalises our power relationships. We use a talking piece, and people sequentially answer questions from the facilitator, which are based around those 4 questions. Who's been hurt and what are their needs? Who is responsible for the harm and repair and what are their obligations? How can harms be repaired and relationships be made right again? And then finally, how can we prevent it from happening again?
The purpose is to just explore some of our experiences and reflect on the surgical mesh experience in particular of sitting in the circles.
The role of the facilitator is really important in that, because the facilitator needs to prepare all the parties, they need to explain the process, they need to ensure that it's safe to bring people together, and they need to be multi-partial. They need to be able to support and see an issue from all those different people's perspectives. The greater the harm, the higher the skill of the facilitator that is required.
The surgical mesh issue unearthed a whole lot of trauma and a whole lot of damage. We had been raising concerns for years and banging our heads against a brick wall, and it felt like nobody was listening. Even though I was sceptical about doing the restorative process to start with, I think it was the right move, because you can't keep doing the same thing and expecting something to change.
It is about having a forum that everyone is safe, the participants and those that are sharing their experiences.
We really wanted to get their stories across the board, and we felt the only way we could do that was to listen to the people that have been affected.
This is an opportunity of learning. This is an opportunity to enable the family to share what's happened to them. They don't want the same thing that's happened to them to happen to other people.
You want to know that there's going to be change at the end of it. So there needs to be a clear indication, what action is going to be taken and whether that's going to be evaluated or not, to make sure that what does happen is a quality action and it's meaningful and it does prevent further harm.
Realising that this is just really a mechanism for people to actually express their disquiet, dissatisfaction, their anger at what has happened to them, and it's not personally directed, it's actually, I was just the face of the system. So actually, how do I take that and take that personal anger and actually turn it into something meaningful in response for these people? Something in the system's not working for them. How do we turn that around? How do we learn from what happened to them to ensure that it doesn't happen to other people?
We found that a restorative approach can meet people's psychological and procedural needs in ways that current investigative approaches do not, and that the human impacts of healthcare harm are powerfully communicated by storytelling in restorative circles and facilitated meetings. We concluded that healing and learning from harm is possible when it's located within a relational framework, and that restorative approaches should be offered alongside regulatory structures, policies and procedures in New Zealand. Hoho Tōrongopai should also be offered. Hoho Tōrongopai is a distinct process of peacemaking that is led by Māori and is grounded in the relational approach of Te Ao Māori.
First and foremost, Hoho Tōrongopai is a process of restoring or renewing well-being.
It's tikanga I understand, it's language I understand, and the process itself, Hoho Tōrongopai, is about healing.
There was a complaint about an obstetrician from both the midwife and the client.
The communication between myself and DHB staff. Let's say there was a breakdown of communication. People were tired.
There was a complaint, a disgruntled patient and midwife, about the way certain things were done.
The midwife was Māori and the mama was also Māori, so it really was a no-brainer. This is the time where we need a kaupapa approach.
The offer was then made by us to support a hōhoi te rongo pai process.
And it was really good because instead of a formal complaint going into writing, the fact that we sat down as human beings with a cup of tea, had a mediator there just explaining why the patient felt disgruntled. I was able to explain why certain things had to happen clinically in a certain way, and it seemed to just diffuse the situation rather than become entrenched in a position and hold on to that position and escalate it.
We've got such a lot to learn from a kaupapa Māori approach. That sets a way forward which is tried and tested, if you like. We love research in health. This has been researched over hundreds and hundreds of years by Māori.
As Māori, we thrash it out until we come to some resolution. And, you know, it could be that sometimes, you know, we may agree to disagree. But I see it as a process that enables people to maintain mana for themselves. And of course, mana, each of us has it. Hoho te rongo pai is just a living, breathing thing.
The benefits of restorative practice in mental health are quite varied. It is really applicable in areas where there is a lot of complexity and where we deal with uncertainty in our day-to-day lives.
So in healthcare, there's things going wrong all the time. So there's no shortage of opportunities to try this really simple approach.
What was the event? What allowed that to happen? And then potentially, how do you move forward from that from a resolution or reparation perspective?
Because there is often an uncertainty in managing people's psychological distress and managing mental health issues. Because those harms, that trauma, that grief also occur to the clinicians and the staff involved. And that has a really significant impact over the longer term for those people.
You know, healthcare is best when humans sit together and spend time seeing, hearing and understanding each other and really figuring out what needs to happen.
I think at every level in our health system, we should be seeing restorative practice and hoi te rongo pai as a process for patient relations.
I think the way to do this is actually show its utility, show its advantage, and show people how to do it.
What I'd say to healthcare providers that are considering taking on a restorative approach who might be worried that it's going to be costly and expensive or that they won't be able to engage senior clinicians in this process, our experience is contrary to that. We're currently spending a phenomenal amount of money on dispute resolution within the health sector. There is a huge emotional and social cost to our patients and our communities. This actually provides us with a way to proactively treat and heal people when they've entrusted their safety to us.
Unless all of those levels demonstrate a commitment to restorative practice, to hoi te rongo pai, then you're not getting the best you can out of these processes.
I think there needs to be a common vision and a common goal about the philosophy and the attitudes that people have within the system to enable it to work.
It is all about people, about the wellness of our people. Essentially, yes, it's whakapapa.
Mai te tipua, mai te tāwhito, mai te kāhui o ngā āriki mai tāwhiwhi atu ki a rongo, tuturu whakamaua kia tīna, haumie, huie, dai ki e.